What's up, you guys? My name is Adrian, and welcome back. So, I'm kind of a mess right now, so bear with me. And if you hear noise, I think the neighbors are destroying their apartment, even though it's midnight on a Thursday, but whatever. Um, I'm I'm really dealing with a lot medically. Um, in February, I was diagnosed with PCOS, which is polycystic ovarian syndrome, and my particular case is very rough. Um, like my insulin resistance is very bad. Like just 2 days ago, I was making dinner and my sugar crashed. And when it first gets really low, I just get shaky. And then once it gets even lower, I get into this mental fog. But within a matter of 5 minutes, I was in that mental fog. I couldn't really remember anything. All I knew was I needed to eat. And that was how it was going to fix it. And so I hurried up. I was heating up spaghetti. Like, lovely. And so I just kind of was very scared because it's never crashed that hard that fast before. I couldn't remember the last time I had eaten. I couldn't remember anything really. But once I had eaten and I got my sugar back up, I was fine. I could remember I had eaten 3 hours before. I had some peaches and a granola bar. I should have been fine. My sugar should not have crashed. And it did. My family doctor wants me to be put on metformin, which is something they give diabetic people to regulate their insulin because obviously my body's like, you don't need it. And because if we don't get my sugar leveled out and sorted, I will have type 2 diabetes. And we don't want that. That's not great. And so there's that. But because I don't want to go see an OB, and I told her that, she said, that's fine. We'll just have your new endo deal with it. Well, I don't see my new endo until June. And at that'll be my first appointment. But they're already better than the last endo I was seeing. So that's good. And I say that because I know what this appointment's going to be. They're doing lab work, which I've never had my hormone levels tested, which is really dangerous. They were never tested before I started T. They've never been tested since I've started T, and I've been on T for almost 10 months. That's a problem. But with my PCOS, like, obviously there's cysts. And with my particular case, my cysts burst. And I average about 2 cysts a week. And they're incredibly painful. They double you over into the fetal position, and I cry. Like, they are very painful. And I tell you what, that is the most pain I've ever been in. And then I'm sore the next couple days after that. My groin hurts, my back hurts, my stomach hurts. And something they don't tell you is that groin pain also creeps down into your thighs, like your inner thigh. And that really hurts too. So walking doesn't feel great the next day when you're sore. And I've always had PCOS. We know because there's a lot of telltale traits. And with that's like irregular bleeding, and then excess body hair, and oily skin with acne. And I have all of that. And there's also like weight problems and things like that. Like, I've had all of that my whole life. But it's weird because I have an older sister that has PCOS, and hers affects her completely differently. She doesn't have the cysts that burst. Her insulin resistance doesn't bother her. Like, she basically doesn't have one. And she has always been this super petite person, like, to the point where her OB yelled at her for being so skinny. She was like, don't come back in here weighing less than this, like, she's just has a fast metabolism, and that's just her. You would look at her and she's the complete opposite of what you would expect a PCOS patient to have, like, to be. And hers is managed with birth control. She's on a high estrogen birth control. Obviously, I'm on testosterone, so I can't do that. And on top of that, I've been on low estrogen birth control before, and my body does not handle it well. This was well before I started testosterone because my bleeding's always been very irregular. Like, I just bleed for 3 months straight, no big deal. And it's always been very heavy, very painful, like to the point where wearing pants hurt or anything touching my stomach even hurt. It was all just excruciating. And but like, what was I saying? Oh God. But like, so we put me on birth control at that point, and I tried everything that had low estrogen, and my body said, nope, you don't need that. We don't like that. It gave me migraines. It made me extremely moody. Like, there was one time I was standing in the kitchen talking to my mom, and I was laughing. And then I started full on sobbing, and I look at her and I go, I don't know why I'm crying. I'm happy. And I had a migraine on top of it. And it was horrible. And then I mentioned, I was like, I was fine until it was my second month on this birth control. And she was, oh no, we're taking you off that right now. And that was it. And now I'm on the depot shot. And I've been on it for a little over a year. And it's worked good. But I have had the breakthrough bleeding where the depot shot doesn't work for the full 3 months, which at this point is pretty typical. But now I've been bleeding for 2 months straight. And I don't know what to do. It's really taking a toll on my mental health. And it's making this condition, on top of me being trans, is making it very hard for me to find a job. Because a lot of people look at me as a liability because of my insulin crashing. Because it's just not something I can control at this point. I'm not on medication for it yet. Like, I left the restaurant I worked at because I had another job lined up, a better paying job that was closer to home. And I get there and I ended up leaving in the middle of the first day because they were so transphobic. They put my safety at risk. But I'm going to make an entire video on that because I don't want anyone else to have to go through that. That was horrible. And now I'm job hunting, and it wouldn't be so serious if I didn't just get my own apartment. I now live on my own. I have to pay rent. I have to pay bills. I'm okay until the end of June. I have enough saved up for the next month in terms of bills. However, I still am going to be like, okay, at the end of that, I'm kind of screwed if I don't have a job. And I don't know what to do. I had an interview, and those people never called me back. I've put in probably anywhere from 20 to 30 applications just this week alone, and no one's called me back. I haven't heard back from anyone. I called a bunch of people, a bunch of places and stuff, and I was told to come in and pick up an application. But today I wasn't feeling great. Like, I was super crampy and everything else, so I stayed home and decided we'll deal with it tomorrow. I don't know what to do. Like, I tell employers that I'm trans, and they're like, okay. They don't know what to do with me. Especially, like, I've been looking at warehousing jobs because those pay closer to what I'm wanting to make. And because at the bare minimum, actually, we're not going to get into finances, but a lot of them are very strict on, like, name tags and things like that. Like, I know Walmart and Chewy, the place I left, both, they want your name tag to have your legal name on it, whether you're trans or not. But my mom works for a cleaning company that cleans warehouses and whatnot, and I had an interview with them, and they said that's no big deal. They just have to talk to their contractors to make sure it's okay with them. And they're really hoping, the way they talked, if I get hired on, is worst case scenario, I would have, like, my first initial, which is A. and then just my last name, which is fine because I'm not outed that way and it's fine. I'm safe. But I haven't heard back from them, so I don't think I'm getting hired on there. And then when I told them about my insulin resistance, you could tell that it really worried them and made them really question if they want to hire me. And so I don't know what to do with that. Because it's not like I can just not tell them that I have this insulin resistance, because I need to know that when my sugar crashes, I'm not going to get in trouble for going to get something to eat or some orange juice to bring my sugar back up so I don't pass out, you know? That's just, it's a medical need. They need to know about it, you know? And no one really wants to deal with that. And because I live in Indiana, it's perfectly legal for them to not hire me for me being trans. And that's just kind of how it is. I told my family doctor once I was diagnosed that I want a hysto, because a hysterectomy will just make my life easier. Because I'm tired of being in pain. It's not fun. And it's mentally and physically exhausting. Whether it's a cyst pain from a cyst bursting, or it's pain from a cyst being just large enough that it's putting pressure but not large enough to burst, or it's cramps from me bleeding. It's just always some kind of pain, whether it's physical or emotional, you know? Because both of them, okay, rude, but both of them, cause a lot of mental draining on me, because it causes dysphoria, and it makes me just want to, when I get really dysphoric, I get anxious and I get really depressed, which I have both generalized anxiety disorder and depression. And so it just kind of makes it worse. And I don't know what to do with it. And neither does my family doctor. I'm really reaching my limit with it, though, and I'm ready to give up and just be just send me to an OB so I can get this taken out. But with my insurance, because I only have Medicaid, I don't have private insurance, they want to send me to Dr. Gentry, which he is horrible. He almost killed my mom and one of my aunts. And I say that because he's botched both of their surgeries. My mom had an ablation surgery done, and she ended up in the hospital with a staph B infection. And it's from that surgery. And then my aunt, he cut her bladder in half during a hysterectomy. And that's just not happening. That's absolutely not. And on top of that, I refuse to see an OB that's male. That's just not going to happen. And if I have to have any more ultrasounds done, I'm going to request that the person that did it in order to get my diagnosis does it, because no one else is doing it. She was absolutely amazing. If you don't know, in order to get your diagnosis, you have to have an internal and an external ultrasound done. And I was okay with the external one, not a big deal. And this lady, she was amazing. I talked to her multiple times beforehand. I went to the doctor. It was probably in late January, early February, somewhere in there. Because in November, I started having cysts burst. And I knew that's what had happened. It was horrible. And they really started bursting consistently in the beginning of January. And at this point, I had moved out of my mom's and in with some family friends who are EMTs. And I explained the pain I was having, and they said, that sounds like a cyst. And I was like, oh, great. And so I went to the doctor, and she was like, yep, it definitely sounds like cysts, but this is what we have to do. And so she printed off the paperwork and sent me down the hall to go schedule the ultrasound. And I scheduled it a week ahead. And it was actually less than a week. It was 4 days later. But I talked to the lady then. She brought me back to the room and showed me the room and everything. And and she was really nice. She understood why this was so difficult for me. She was like, obviously, this is hard for a lot of people, but it's especially hard for you. I understand. It's fine. It's going to be okay. And if we ever need to take a break during it, we absolutely can. And I called her it was the day before I called her because I had more questions. And she answered all of my questions. She was super great. And then during the ultrasounds, I was really having a panic attack. But I kept it together, and at the end, she steps out to let you go get dressed. And I lost it. I had a panic attack after so bad that I'm sitting on the bathroom floor, hyperventilating and sobbing. And this lady, she's so kind. She has some little kids, very young kids. And you could tell. She went into instant, like, protective mom mode. Like, she was knocking on the door, trying to get me to come out. But I couldn't even bring myself to come out for a while. I was just on the bathroom floor sobbing. And I made my mom go with me because I knew I wouldn't be okay to drive after. Just like mentally. And so she finally got me out there, and which, mind you, during the whole procedure, she was like, just let me know if we need to take a break. It's fine. And I wouldn't take that break because I knew I wouldn't be able to go back and finish. And I knew I needed this diagnosis in order to get things taken care of. And so she sat me down in a chair outside. I had left my phone in the room. I was on my phone throughout most of the ultrasound, trying to distract myself. And I left it on the bed, and I told her that. And she's like, okay, don't go in there. I've got it. Because she didn't want me to go back into that room where the trauma happened. And she was like, okay, what can I do for you? And I was just like, I don't know. And I'm just sobbing and hyperventilating. And she's like, okay, I'm going to go get your mom. Because I made my mom wait in the waiting room. I was like, you're not going back with me. That's not happening. And so she went and got my mom. She was like, you guys just take your time. It's no big deal. And she was just super sweet the whole time. And honestly, I don't think I can trust anyone else to do it. She was just absolutely awesome. But I wish there was another way. I feel like technology should have advanced past needing an ultrasound to find this out. I feel like there should be another way around it. That way it's not so hard for anyone mentally, especially trans patients. But I'm very mentally drained. I'm not coping well, and I'm really freaking out about not having a job. I'm thinking about going back to the restaurant I was at, despite I won't be making enough money to live where I'm at. And where I'm at is one of the cheapest places you can live near where I'm at. Like, aside from living in Indy, which I'm not about to live in Indy, I would get lost. I know I need to go back to therapy, but I also need to figure everything out. Lately, it's been a lot of just like wanting to cry. And I don't want to be like that anymore. It's been a long time since I felt like this, and I don't like it. I don't want to feel like it. And I'm super lethargic. Right now it's because I'm bleeding, but also because, hi, depression, it's great. Which I am on an antidepressant and an anti-anxiety medication. They're paired up together. It's the same medicine. And I know I should probably get my dose increased, but every time we've tried to do it, it makes my anxiety so bad I can't function. And I can't afford that at this point either. also can't afford to take off work for 6 weeks. If and when I get a job, if I do get a histo anytime soon. And on top of that, like, I can't have a histo right now, because my sister's getting married in June, and I'm going, and it's an out-of-state wedding, so I have to fly, and I'm going to be gone for almost a week for this wedding. I have a lot going on top of me. I'm supposed to graduate this year. And because my mental health is not where it's supposed to be, and I'm in pain all the time, I'm not getting as much work done as I need. And that's hurting my mental health even more, because I feel like I'm just a failure. And it's to the point where the school had a social worker call me, because they're like, what's wrong? Because I do have a history of my mental health falling apart and me not doing it very well. And they know that. Especially one of my teachers. I've had her for like 3 years straight now, for different classes. And I know she's the one that told them we need to have someone check on this kid. But I don't know what to do, because it's too late in the year to implement a 504 plan. And everything lined up so perfect when I got this apartment. I had that new job lined up. I had this apartment. I had everything. And it's all really fallen apart. And I don't know what to do with that. I'm really just hoping it'll get better. I don't know what to do. But if anyone else, like, basically why I suddenly was having all these issues is because my testosterone has aggravated it, because PCOS is caused by excess testosterone, which causes excess androgen, and that androgen is what basically turns it into and causes the cysts. So my testosterone has just made my PCOS 10 times worse than what it was before I started testosterone. I'm talking, I've always had so much excess testosterone that, like, middle school boys, when they start puberty, get that dark peach fuzz. Like, I've had that since elementary school. And I used to get teased for having so much body hair, especially on my legs. And things like that. Like, it's all just like the telltale signs and this and that. And no one knows what to do with me. And I told my mom about my sugar dropping. And she's worried, because it's never done that before. Her boyfriend is diabetic, and his sugar bottoms out all the time. And he gets confused even worse than I did. And we're afraid I'm going to get to that point. I'm talking, we've had to go find him because he's gotten lost driving, and he'll call her and say, I don't know where I'm at or how I got here. And we're like, okay, well, what road are you on? And he'll tell us. And then we'll have to go get him. And he's straight up passed out in his house a couple different times from his sugar bottoming out. We're scared that's going to be the point I get to. And it's just not safe. It's not healthy. I don't know what to do. And if anyone else knows, that'd be great. I'll see you guys later.